Good afternoon, everyone. This is Channel 5 News reporting from Woodland Hills. I'm your host, Frank Garcia, with an upcoming segment on the rise of insulin prices. But first, the numbers. Today is not good for all our investors, with the Dow down 0.42%, NASDAQ and S&P are sliding. The NASDAQ down 2.22%, and the S&P about 1%. So, the price of insulin in the US, especially California, has more than doubled since 2012. Good afternoon, everyone. This is Channel 5 News reporting from Woodland Hills. I'm your host, Frank Garcia, with an upcoming segment on the rise of insulin prices. But first, the numbers. Today is not good for all investors, with the Dow down 0.42%, NASDAQ and S&P are sliding, with the NASDAQ down 2.22% and the S&P about 1%. So, the price of insulin in the US, especially California, has more than doubled since 2012, leaving many diabetics with two options: to fall in debt or to slowly die. In fact, according to the CDC, Centers of Disease Control and Prevention, about 1 in 10 people have diabetes in the US. To make the situation worse, small numbers of existing companies that sell it, like Novo Nordisk, greatly increase the prices of insulin. There's hardly any competition with the prices, therefore limiting diabetic people's choices, forcing them to overpay for a drug that costs only a few dollars to make because they need it to survive. Now I'll pass the baton to Vincent Rogg from the city of West Hills, who will elaborate on the situation further and bring you some statistics. Off to you, Vincent.
Thanks, Frank. It is evident that the insulin market has radically changed from the early 2000s. For one, the cost of insulin has nearly tripled from 2002 to 2013, with rival companies emerging in the mix, according to Ken Altucker from USA Today. Novo Nordisk is a leading European company in the insulin market alongside competitors such as Eli Lilly and Sanofi. Nikolai Skygaard from The Independent states that to make profits and overcome competitors, Novo Nordisk has raised the price of their rapid-acting insulin Novolog by 628% since 2001 by hiking the price 28 times, leaving Americans struggling to pay for the life-saving drug. These hikes in price occurred in response to the competitive market, specifically Eli Lilly's Humalog drug. Novo Nordisk also increased the price of their long-acting insulin Levemar drug 18 times, by a total of 360% between 2006 and 2019 as a response to Sanofi's price hikes on its Lantus product. It is clear that these companies prioritize profits over the well-being of American people. There is really no need to increase the price of a life-saving drug unless the company seeks profit and control of the market. To add to the severity of the issues, Novo Nordisk has been at fault for downplaying the risk of their insulin product Victoza. The U.S. Food and Drug Administration's mandated warnings about the cancer risk of diabetes medication was ignored by the company and cost Novo Nordisk nearly $58 million, as reported by Nate Ruman of Reuters. Novo Nordisk has clearly had a history of violations that harm the well-being of U.S. citizens. Because cancer risks were hidden by the company, medical workers were not able to make accurate decisions for patients. The FDA requires important information, such as the possible risks associated with drugs, to be known to doctors. On that note, it is apparent that massive companies like Novo Nordisk create suffering when it could be avoided. It is not a surprise that the company has tried to monopolize their insulin to make profits. The non-stop rising price of insulin from companies such as Novo Nordisk is causing many people with diabetes to not be able to afford it, leaving them at risk of death or debt. The prices have been at a non-stop rise, which is what has caused this problem over the past 20 years, especially for type 1 diabetics in Los Angeles. The exponential increase in the cost of insulin is dangerous because it leaves individuals who can't afford it at risk of death or a lifetime of debt. About 3 million Californians have diabetes, and about 1 million of those Californians need to take the drug to control the disease. For more on the hefty insurance prices and insulin market, I am joined by Dominic Copeland, a fellow researcher at El Camino. Take it off, Dominic.
Thanks, Vincent. The rise in insulin prices have caused diabetics who cannot afford it to either purchase insulin and fall into debt or not purchase it and risk their life. Diabetics do not choose to inherit this disease. Therefore, it is unfair for many diabetics to be pushed to choose these two options. Many diabetics, specifically type 1 diabetes, who choose to allow financial aid companies to help them afford insulin can suffer from the financial burdens. In Bram Siebel-Smith's article, Insulin's High Cost Leads to Lethal Rationing, he says that diabetics still have to pay a lot of out-of-pocket money before their coverage kicks in. Dr. Smith's many years of experience in the medical field has led him to write this article after seeing the injustice major companies have committed. Because of this, many of these diabetics switch to cheaper insulin, which numerous doctors do not endorse because it isn't as effective as their recommendations. Furthermore, It frequently causes more medical complications and consequently more medical bills, meaning that they could potentially be stuck in a cycle of debt. He also mentioned that about 1 in 5 Americans have medical debt on their credit reports, and that there is a large number specifically due to insulin. It's apparent that diabetic Americans are forced into a state of continuous medical debt. There's also many diabetics who choose to not purchase insulin because they simply cannot afford it. Even with the financial aid, Altucker says that many type 1 diabetics paid an average of $5,705 for insulin in 2016. That's nearly double what they paid in 2012, according to the Healthcare Cost Institute. Taking a look at the average prices for the recommended insulin, there should be no surprise when finding out that many people cannot afford it. It is also shown that many people resorted to extreme measures such as taking less than the doctor prescribed to make it last longer, acquiring the drug from friends, or getting it from less expensive pharmacies in Canada or Mexico. The ones who cannot afford it tend to purchase only a fraction of what their body needs, which then puts them in a life-threatening situation. The spike in insulin costs caused many more diabetics to not be able to afford insulin, especially because of the low competition that companies that sell it have, like Novo Nordisk. The article, Eli Lilly and Company to Drop Insulin Costs 40% in the US, by Samantha McGrail, who is a pharmacist, says that the price of insulin has put the life-saving hormone out of reach for many people with diabetes, and has left others scrambling for solutions to afford the one thing they need to live. Many people do not realize the severity of the situation. Novo Nordisk is one of the companies that is purposely increasing the cost of insulin for the sole purpose of financial gain and greed. Even insurance plans like Medicare have restrictions, such as citizenship, and are largely dependent on income. Paying for insulin has various financial drawbacks, and with the added burden of high prices, diabetic Americans are struggling to survive. Luckily, there is a solution: Civica RX. Civica RX, founded by Blue Shield, is a non-profit generic pharmaceutical company with a mission to make high-quality generic medications accessible and affordable for everyone. Civica's insulin price will be transparent to all purchasers with no rebates to obscure the actual cost of the drug, which is expected to be available starting 2024. And in addition, starting on March 3rd, 2020, the nonprofit health plan is partnering in a national initiative with Civica to help manufacture and distribute generic insulins that will cost patients $30 or less per vial, or no more than $55 per box of 5-pen cartridges. Civica is a very new creation and is expected to sell insulin for the lowest cost on the market. It is a nonprofit organization under Blue Shield dedicated to preserving the well-being for diabetic Americans. Civica is going to save the lives of diabetic people and lower the weight of financial cost, and typically those with type 1 diabetics in California. Now to Davin, who will expand on the common misconceptions of insulin and healthcare in general. Here you go, Dave.
Great to see you, Dominic. Many people who do not suffer from diabetes will oftentimes assume that it is covered by healthcare without causing a disturbance in the patient's lives. However, this is not the case. Due to the different private insurance plans, diabetic patients may not directly pay for insulin, but instead see a rise in their insurance bills, which many of them still cannot afford. The average type 1 diabetic will pay $16,752 for more than twice the cost of healthcare for a person without diabetes, as shown in the article Financial Help for Diabetes Care. As private insurance does help cover the price of insulin, this is really a fraction of the cost. In many cases, the ill cannot afford private insurance, which only glorifies the idea that one can live a safe life without healthcare. Government-funded health insurance is available to the general public. However, it is only available to those who apply to it and can afford it. Gary Stroller, who is a part of the Health I team, which spreads information about diseases such as diabetes and options for it, states in his article, Low-Income Diabetics Paying High Prices for Insulin, that low-income Americans get insulin through Medicaid, which provides free medicine for 1 year to low-income patients who meet specific financial qualifications. One has to be making a certain amount of money in order to meet the requirements, and if a person makes too much money, the plan is no longer applicable. 1 year of free Medicare does help many patients, but diabetes is a complex disease that cannot be cured in a year. It takes many years to a lifetime, depending on how severe the type of diabetes is, meaning that the plan is simply not long enough. If one does meet the requirements to Medicaid, they are subject to cheaper insulin. Another option many turn to are discount realtors such as Walmart, where cheaper insulin but older types of insulin is sold, but many doctors won't prescribe it because it is cheaper, which means that the type of insulin is cheaper in this case. In case you are just joining us on our segment on rising insulin prices, my partner Frank will conclude after a word from our.
To sum up, diabetic Americans are given the ultimatum, which is to fund their expensive life-saving medications or suffer the risk of high blood sugar. It is apparent that companies like Novo Nordisk have tried to monopolize the insulin market at the expense of U.S. citizens. Competition among these companies doesn't help the situation either. In fact, this competition had increased the price of Novo Nordisk product. There's no reason other than the greed to sell a life-saving product at such an expensive cost when it only takes a few dollars to make. To solve this problem, the price of insulin must be lowered or brought from a different company. Such as the nonprofit company Civica RX, the option of lowering prices will be challenging. However, with the help of Blue Cross, this may be the best possible option. The greedy price increase of insulin leaves many diabetics in the United States, especially type 1 diabetics in Southern California, in a tough situation because they cannot afford the drug. An important aspect of this problem is the fact that not everyone has healthcare nationwide. Where many foreign countries supply free, reliable healthcare, the US is overtaken by companies like Novo Nordisk and their monopolization of life-saving drugs. The US needs to stop companies like Novo Nordisk from taking advantages from one disability and draining the money out of American pockets. This is Channel 5 with your host, Frank Garcia. Thank you for listening.